Hello, my name is Tilman Emrich and I'm from the University Medical Center Mainz in Germany. And I'm here to summarize the result of our study for ultra-high resolution photon-counting CT for the assessment of coronary artery stenosis. So I think you heard that coronary CT angiography is an established first-line test for the assessment of coronary artery disease. And with this non-invasive test, we can actually evaluate the presence and the extent of coronary artery plaques and their effect on the coronary artery lumen. And typically, the radiologist will then grade the stenosis and translate the severity of stenosis into a recommendation to a so-called CAT-RADS classification, which then guides the downstream testing and potential therapy after the CT. However, with conventional CT, the accuracy is limited, especially in cases of calcified plaques. And this is mainly caused by a phenomenon which is called calcium blooming, which means that calcium appears larger than it actually is. And the clinical result of this is an overestimation of stenosis and overdiagnosis of disease, which may lead to potential unnecessary downstream investigations, including invasive tests. So since 2 years, a new type of CT scanner has become clinically available, which is photon-counting CT. And photon-counting CT has the advantage of increased spatial resolution. And we ask ourselves in this study, what effect does this increased spatial resolution have on the measurement of coronary artery stenosis and potential the associated downstream testing and therapy? So what we did is we generated a simulation study, and in this simulation study, we took ultra-high resolution photon-counting scans and downsampled them to look like a conventional CT. And then an observer measured the coronary artery stenosis in a vessel phantom first, and then in 114 patients with a clinical indication for a cardiac CT. And what we found is that the increased spatial resolution, ultra-high resolution, leads to a lower stenosis grading and measurement in the vessel phantom as well in the patients. And that was especially true for the calcified plaques that the patients had. So what is the clinical result of this? By using ultra-high resolution in the photon-counting CT, over 50% of patients were reclassified into a lower CAT-RADS classification, and that means that almost half the rate of downstream testing investigations, such as invasive coronary angiography, would have been deferred based on the results of ultra-high resolution. Of course, this is a simulation study, and that means that there are some limitations of the current design. This is a cross-sectional study where we do not have actually the effect on the downstream measurement taken by different CT scanners, and we have no information on the patient outcomes yet. So all of these results have to be validated in prospective studies. Thank you for listening.